Your health, your life. Expert insight that matters. This is Health Matters.
Welcome to Health Matters. I'm Nicole Taylor, a nurse practitioner with Nikki Lamage Wellness and Alchemist, and I am joined today by Mid-Michigan ENT physician, Dr. Sufyan. Welcome.
Thank you for having me.
I feel like right now is such a great time to have you. Allergy season, all these things are coming up, and you're a busy guy. I wanted to start with, though, asking you about breathing through our nose. I heard that this is more important than what we think.
Yeah, and there's a lot of important functions that happen when we breathe through our nose that we sometimes take for granted. For example, breathing through the nose is the body's way of filtering air. Also, we have built-in humidification centers in the nose which humidify the air. So when you're taking a deep breath, if you're breathing through your mouth, that air is unhumidified. It can dry out your mouth, lead to some problems. But breathing through your nose not only will humidify the air, filter the air, it actually improves oxygenation. The body likes humidified air, so when it goes into the lungs, that oxygen is easier to extract. And we know that people that don't breathe through their nose when they're sleeping, they open their mouths. A lot of times that can lead to dry mouth, dental problems. Can also lead to snoring, which keeps a lot of people up at night. And if you're able to close your mouth and breathe through your nose, you have all the benefits that we just talked about. So we are really designed to breathe through the nose. And there's many people that every day live their lives struggling to breathe through their nose. So it's really important to try to figure out what's causing the difficulty breathing through their nose.
Yeah, I would never have thought about it humidifying and filtering, and it makes sense when you say it, but not once have I thought about it that way.
Yeah, and even some people will say, I thought it was normal to not be able to breathe through my nose. And a lot of times you'll have people that have some structural problems they're just unaware of. Happened, during childhood, they trip, they fall, they smack their nose, and, no one really thinks about it, or they haven't been examined by a physician to diagnose it. And then during the spring, they realize that, it's getting a little harder to breathe. And a lot of times people that have the structural problems will also have allergies at the same time. And the problem with having allergies is a lot of times people experience swelling in their nose. And if you already have a narrow airway, that swelling can lead to severe congestion and difficulty breathing. So, during this time when trees are just pollinating, patients and people will realize that it's a little harder to breathe. So, I think if you're experiencing any of those symptoms, it's always good to get it checked out.
What are some clues that it's a structural issue versus it's just my allergies?
Yeah, I think it's a great question. Structural issues are usually constant, meaning they're always there. So it's not like your nasal septum, which is a wall that blocks one side or divides one side from the other. That can't move. So patients that have constant difficulty breathing, regardless of the season, usually means that there's some structural problems. Other times there can be injuries or deformities to the outside of the nose that are visible. So those are all kind of indicators that there might be some structural problems. For individuals that say they can breathe fine and then during the spring or summer begin to have problems, then we begin to think about allergies. And again, it can be a combination of both.
Are allergies usually just seasonal, or can somebody have allergy problems year-round?
Some allergies are seasonal. When we think about seasonal allergies, we're thinking about the trees, which happen in the early spring, some of the grasses, kind of later spring, the weeds, which can be throughout the summer and late and early fall. But there are some allergies that go all year round. For example, dust mite allergies, pet dander, especially if you have pets in your home, that would be all year round. So we're able to test individuals and figure out what exactly they're allergic to so that we can tell them how to manage their allergies.
So if you test an individual, what does that look like?
For most people, it would be an examination by your physician, kind of look in the nose, look at the signs of allergy, and then to prove what they're allergic to and the severity of their allergies. Typically that involves skin testing. And skin testing, I would say for the majority of people, is the most accurate way of testing. Some individuals who are unable, either have skin conditions or on medications that prevent them from having skin testing, we can order a blood test and look to see what they react to. But in general, typically we test for 30 to 40 things, and that involves all the pollens, the danders, dust mites, and we can come up with a comprehensive plan to treat those individuals.
So when we talk about a comprehensive plan, because I know there's lots of people with allergies that are going, what is it? What might that include?
Yeah, so for each individual, you have to look at that patient and see what problems do they have. If it's structural problems, then a lot of times we address the structural issues, and that can include surgery or other minimally invasive office-based procedures. And the way I like to think about it is you have your structural problems that we fix structurally, and then you have your medical problems such as allergies or other reactive diseases that need to be addressed medically. And we come up with a comprehensive treatment plan for that individual, and we tackle each problem one at a time. And I would say for most individuals, the success of getting that treatment plan is in the high 90s. So most people have excellent relief. It's rare, or if you have very severe allergies, there are people that require kind of a longer period of treatment before they're able to appreciate the benefit. But that's a small subset.
Oh, 90% though is pretty outstanding.
It's pretty good. Yeah, pretty good.
So they don't have to go around suffering. There's options here.
Yeah, and I think one of the stigmas we'd like to kind of get rid of is historically, 30, 40 years ago, nasal surgery was thought to be kind of this really challenging recovery. Nowadays, people have surgery within a day or two, they're feeling great, minimal recovery. So I think that's something that we need to dispel. And, because a lot of times patients suffer with the nasal problems or difficulty breathing, and they heard a story from a friend or something many years ago, and they think, technology advances, and the goal is to get people better with the least amount of discomfort. And I think we're at a place now where the technology is so good, we're able to offer treatments in office and sometimes in the operating room with minimal recovery.
Yeah, this is new to me because I always think of those old surgeries and the two black eyes, and they're out for the count, and everybody knows they had something.
Yeah, that's exactly what we're talking about. Yeah. I would say my patients and my surgeries, no black eyes. We don't pack the nose, and many times people, if they work at home, the next day they can resume some activities. Usually we say you need time to heal. So some of these procedures will require a few days, but it just really depends on what they're getting.
So when you talk about office procedures, what kind of office procedures can you do for the nose?
Yeah, in some cases, depending on what we find, there's excess tissue in the nose. There are these devices that we use to shrink the tissue in the nose. That procedure takes about 5 or 10 minutes. There's no recovery. Typically, we have patients take it easy that day, but they're pretty much back to normal the next day. There are other procedures that are a little bit more involved to tackle other issues, and even if there's structural problems, we can address those in the office for many patients. In some cases, if they have bad allergies, there's even some sinus procedures that we are now doing in the office.
That's amazing. Out of the surgical, side of things and into an office. And
yeah, I think COVID really accelerated a lot of those technologies when we were unable to do procedures, or we were restricted from using the hospitals. It really forced the industry to come up with new technologies, and it's been beneficial for society. So now we have so many more options available.
I think that's fantastic.
Oh, for sure. And patients appreciate not having to take weeks off or months before, a couple days, and they're back to normal.
Well, yeah, it's less disruptive. They have better recovery and healing, and they can go on to live their lives. Now, you and I spoke a little bit earlier, and I thought this was really interesting. We were talking about not opening the windows on these nice days?
Yeah, unfortunately, we all look forward to the beautiful weather, but if you have allergies, opening the window will allow a lot of that pollens and some of the dust to come in. So a lot of times patients will say, I wake up and my throat is irritated, have a lot of drainage. These are all signs of allergies. Another thing could be that sometimes when people are sleeping and they're unable to breathe through their nose, by default, they have to open their mouth, and breathing through your mouth will dry out your mouth and actually lead to some snoring. That can also lead to some irritation of the throat. So a combination of the allergies coming through the window, and then your nose is congested, forces you to open your mouth. That leads to that snoring. So we recommend, probably if you know you have allergies, not a good idea to open the windows. Other recommendations that I think are helpful, if you're doing a lot of yard work, you may want to consider wearing a mask. And, I think if it gets to a point where, despite trying all of these things, you're still symptomatic, then that's usually when we recommend being examined and treated.
That's good information. And I will say I'm guilty. I go outside and I do yard work. I don't think I've ever worn a mask, and then I come in miserable. So
yeah, unfortunately, in Michigan, we try to cherish the days that we have, but those are the days when it rains. Actually, a lot of that pollen is washed away. So during the sunny days is when you have to take even more precaution.
Let's see. Now we have to appreciate the rain more.
That's right. That's right.
So now, if somebody has a spouse that is snoring, I get this complaint. I had somebody tell me I'm not sleeping at night because he's shaking the bed.
Sure.
Thoughts of what they could do? I've seen lots of infomercials, and I don't know what's real and what's not.
Yeah, I think there's a lot of, because it's such a problem, there's a lot of products out, and most of these products don't work. If it was a simple fix, we'd be recommending it. Getting a good examination to determine what the anatomical causes are. Some people, the snoring will be caused by nasal issues or, structural issues in the nose. Other people can have large tonsils or a small throat or some dental issues that's causing restriction. So really getting a thorough examination to figure out where the blockage points are. We know that patients that have nasal surgery to improve their breathing, almost 50% of them have reduction in snoring. So we usually like to start with the nose just because it's a lot easier recovery than doing surgery in the throat in an adult. We know that many children have their tonsils removed, and that procedure in children is a lot more tolerable than it is in an adult. So we start there, but again, it really requires a thorough examination to come up with the exact reason that individual is snoring. But I do think people should get that looked at, because not only is it disruptive for the spouse or the partner, but it's disruptive for the patient. If you're snoring, that prevents you from staying in a deep sleep, and that restful sleep is something that is very important to the overall health of the individual. So if we can get them breathing better, they sleep better. And I have many patients tell me after I do their surgery that they started dreaming again. And we know that you dream when you're in a deep sleep. And if you're not dreaming, that might be another sign that you're not getting into deep sleeps.
Oh, that's interesting. I'm sure people are watching this going, oh my gosh, we can start with an exam.
That's right.
And lead to this, progress on their snoring. What are some other tips you would have for our viewers?
Yeah, I think, keeping track, it's very important to have a good history and an understanding of how their symptoms are aggravated. So keeping track of when they struggle to breathe, if it's constant, if it's intermittent, that's very helpful when they see their physician. Talking about what treatments they've tried in the past, keeping track of that as well, to see what things have worked or what things haven't worked, so they don't have to repeat that whole thing. And then ultimately seeking care. I mean, I think that's the biggest hurdle. Most people just don't go in and get examined. One thing is, if you have allergies, I think it's always okay to try over-the-counter antihistamines. Those are safe for daily use. Nasal sprays like nasal steroids, those are also safe. I would recommend avoiding nasal decongestants. Okay. Those can lead to problems and really make things worse. So I would say an antihistamine, over-the-counter antihistamine, some of the non-drowsy ones work fine at bedtime, and then a nasal spray, a nasal steroid. Those are things you can try. And if you have improvement, then we can confidently say there's definitely a component of allergy, because those medications are targeting allergens.
Final thoughts and things that we want to share, lifestyle tips.
Yeah, I think, we have to breathe, and it's really important that if you're struggling with breathing, or you have structural problems or a history of nasal injuries, we recommend seeking care, because you shouldn't have to suffer with this for the rest of your life. Many patients that I take care of will tell me, I didn't realize how easy the process would be. I wish I would have had this done years ago. So I think getting that process started will get you quicker to the best that you can be.
And I have to agree. I don't believe people realize that there's this many. I didn't realize there's this many options. And, we've been in healthcare for quite some time. And it's nice to know that it can be as simple as getting evaluated, some office procedures, and moving on.
Yeah, so again, I think it's something that if they get it looked at, there'll be many options.
Dr. Sufyan, what do you think of neti pots?
I like neti pots. Essentially what a neti pot is a device that delivers a saline solution, basically water with salt. It's important to use clean water. And it flushes out the nose to remove some of the pollens, the excess mucus that we have. I think in conjunction with other treatments, it works really well and helps a lot of patients. So I tell all my patients it's a good idea to try it. Some people will do it in the morning when they shower to flush out their nose, and it keeps the nose nice and moist.
Okay, so neti pots are an in. I appreciate all your wisdom. Thank you for joining us today.
Thank you.
It's Dr. Ross, board-certified gastroenterologist with a health tip. Exercise is a great way to keep your digestive system moving. It stimulates your GI tract, lowering your risk of constipation and colorectal cancer.
All right, Dr. Dimitra, kidney stones are known for being extremely painful, but what are they?
Kidney stones are just crystals that form in the urine up in the kidneys, and they can sit there for a long time, or they can eventually try to come out into the ureter and pass. And that's when people get the horrific pain that everybody talks about. So that pain usually starts in the back. It can make your way down forwards here into what we call the flank, and then migrate down into the pelvis, sometimes even into the groin, the bladder, and the urethra. My female patients tell me it's worse than childbirth, and I'll take their word for that.
Ooh.
But it's really, really bad.
Yeah, that would be bad. What are some warning signs that somebody's going to have a kidney stone?
Well, the pain is usually the first sign. Sometimes they have blood in the urine. Sometimes they have the urinary symptoms, some burning, frequency, urgency. They can see blood in the urine, certainly. But some of the patients that we see who have actually pretty big kidney stones, the only symptom they have was recurring urinary tract infections.
Oh, okay. And then how do you know if it'll pass on its own or if they need intervention?
The stones are diagnosed usually with an imaging study like a CAT scan, and we can see the size of the stone. If the stone is 5 millimeters or less, usually those will pass with some help with some medication and hydration. If the stones are 6 millimeters or larger, you're probably going to need to have an operation.
So size matters.
Absolutely.
Okay. Well, thank you for being here. I'm Nicole with Nikki Lamash Wellness, and remember, small intentional changes can make a big impact on your health.
Most people are familiar with braces. We like to treat patients with clear aligners. They're virtually invisible, a lot more comfortable, and they can shorten the treatment time by weeks to months.
So, Dr. Sufyan, I swear my father can't hear anything I say. When should somebody go in and seek treatment for hearing loss?
Yeah, I think it's really important. One of the senses that gets ignored is hearing loss. It's ingrained in the culture to seek or to get eye checks every year or every other year. For some reason, hearing loss is not on the priority list. And it's really important because it's one of our senses. We know that patients that have even mild or moderate hearing loss can have an aggravation of dementia even bring on early onset dementia. So it's really important if you're struggling or asking people to repeat themselves or missing some of the words, especially in an environment that's a little bit louder. For example, being at a restaurant and having to ask people to repeat themselves, then that's definitely time to get that looked at and get tested.
And what are some of the treatment options? I mean, I always think of hearing aids. Is there anything else that can be done now?
Yeah, sometimes we look in the ears and we find that there's wax that's been there for many years, and that's an easy fix. We can clean that out. Other times, after we obtain a hearing test, we're able to kind of quantify and classify the type of hearing loss, and hearing aids are an option for many individuals. I know historically people shied away from hearing aids because they were bulky and large, but now the technology is, some of these hearing aids, you can't even see them. They're very small, and I think patients appreciate that. So start with an exam, get a hearing test, and find out what options are available to you.
Well, thank you. That's wild about it can aggravate dementia. So when in doubt, go get a hearing test.
Are vasectomies really reversible? Many can be reversed with a delicate microsurgery. Success rates are very high if done within 10 to 15 years. It's not guaranteed, but many men can father children afterward. Consult a specialist early.
All right, I have Georgia from Revision Skincare, my personal favorite, so we have in our clinic. Can you break down, we hear a lot about like medical grade versus, things that aren't medical grade, but I don't think anybody really understands what that means.
Sure. Medical grade is a term that's used a lot. We hear a lot about it. It's really important to understand it's not just a label or a marketing term like people often think. And I think two things happen when people hear medical grade skincare. They either have a sense of confidence in the product and it gives it a credibility, or it creates hesitation. And it's easier for somebody to just go grab something off the shelf at Ulta, Sephora, or drugstore. So what it really comes down to is how the products are formulated or developed and how they work in the skin. So with Revision, for example, we look at clinically validated ingredients, their concentrations, and then our delivery pathways. So we really ensure that the products are driving to the places that are super important to make the change in the skin versus just sitting on top of the skin. So we really there's an emphasis a lot too on the clinical validation, and every medical grade skincare brand is going to clinically study their products, as they should, and it's a phenomenal thing. I love it. But what we do a little bit different is we will do that to pharmaceutical protocols. So we're not regulated by the FDA like pharmaceuticals is to study the products the way that they need to be. And we think that's the gold standard. So we take it to the next level so we can be extremely confident in what our products are going to do when we talk to our providers and talk to the end user. So we're not just guessing what it's doing, we're actually measuring that within the skin. And that's super important.
Well, that is perfect. And that's why we carry your products. They are science driven, and I love that. So thank you for being with us today.
Children that have repeated ear infections or have an infection that lasts many months need to seek treatment to get that corrected to preserve their children's hearing.
Well, I'm joined today by Dr. Scott Plain with the Digestive Health Institute, and I have some questions for you regarding fatty liver disease. I'm seeing patients in the office, they're coming in with these elevated liver enzymes. Can you explain a little bit about that and the symptoms?
Well, symptom-wise, it's very frequently free of symptoms, but when people are having their regular liver chemistries or blood work done, they'll see and experience an elevation in their liver enzymes that you are seeing and then subsequently we're seeing. The reason for that is probably a lot of trends in diet, trends in weight that we're seeing across our culture and our country. And I think that's leading to a lot of these enzyme changes that we're seeing as a result of fat metabolism and fat deposition in the liver.
Okay, so I understand there is a new type of testing out that you're often using now. Can you tell us a little bit about this, what it's called and how it changes things?
Sure, it's an exciting new technology that employs a non-invasive technique to obtain a content of fat in the liver as well as how much scar deposition there might be in the liver. It really replaces liver biopsy in many instances, and we're able to gain a lot of useful information that can help us guide therapy and how we best can approach our patients who may have this fatty liver condition.
And this is kind of an ultrasound, correct?
It's a vibratory ultrasound that is really painless and very quick and easy, and patients really seem to be responding quite well to the ease of it, and it provides a lot of useful information for us and our patients and our referring physicians.
Well, that is exciting. Thank you for joining us and sharing all that great information.
Oh, my pleasure. Thank you.
Life changes everything. Hormones shift, metabolism slows, muscle declines, and skin loses structure. At Nikki Lamage Wellness, we don't treat these as isolated problems, we treat the system. Through precision hormone optimization, metabolic weight loss strategies, IV nutrient therapy, red light sauna, and with the addition of InMode Quantum RF, we now stimulate deep collagen remodeling and targeted fat reduction without surgery. Aging well isn't about chasing youth, it's about restoring power. We're joined today with Dr. Dirksen from Dirksen Dentistry. And Dr. Dirksen, I was a kid that wore braces growing up, but now there's a new technology or newer.
Yep.
How does it actually work? And what is it called?
So clear aligners, most people are familiar with the brand Invisalign, but clear aligners are a way of moving teeth, and they're very, very similar to traditional braces in that they move teeth in slow, small increments. But instead of having the actual metal brackets and the wires connected to your teeth, we do it through a series of these clear plastic trays.
So if they're clear plastic trays, unlike traditional braces, they come in and out?
Yep, they come in and out. So one of the biggest issues that we have with these is compliance. So meaning that if we want somebody to have their teeth move, then they need to make sure they're wearing them. And that gives them the flexibility to take them in and out. But they can be just as effective, or in some cases even more effective than traditional braces.
Is there somebody that's a better candidate for this kind of technology than someone else?
Yep, so individuals that have mild or moderate crowding, so basically if you have consistent crowding and or if you have what's called an open bite, so you bite down on your back teeth and your front teeth remain open, those are going to be candidates that are really, really predictable for clear aligner treatment.
Okay, and what are some of the biggest mistakes that you see when people are wearing these?
It's actually when they're not wearing them, that's the biggest mistake. So if people don't put them in on a daily basis, if they take them out and leave them out for too long, then the teeth won't actually move. The biggest advantage is that they can take them out to eat or drink what they like. Very few people can actually tell that they have them in. And so from that perspective, they're a lot more convenient.
I wish they would have had that when I was a kid.
They work well.
Well, Dr. Dirksen, we're so happy to have you. Thank you for coming today.
Thank you.
When it comes to your health, choosing the right care team matters. At the Urology Institute, you'll find experienced specialists who focus on personalized treatment plans tailored to your needs. We offer advanced technology, a full range of services in one place, and a team that works together to support you every step of the way. From diagnosis through treatment and beyond, our goal is simple: deliver high-quality care with compassion, convenience, and confidence you can trust.
Stay informed at healthmattersmi.com. Thanks for watching.